Today we're talking with Dr. Christina Smith, owner of Full Strength Physical Therapy. Christina is a physical therapist, certified athletic trainer, and board certified sports clinical specialist who's worked with athletes at all levels. Christina, your interest in sports medicine began before you became a physical therapist. What originally drew you to athletic training and then physical therapy?
Hi, Drew. Great question. I was an athlete all through middle school and high school. And when I entered college, I wanted to find a career that sort of kept me in that environment of working with athletes and active people. So I started with athletic training and worked with several teams at my college. And then from there, I decided I really loved the rehabilitation aspect of working with people, and so pursued physical therapy.
Sports medicine remains a major part of your work, but it isn't your only clinical focus.
Mm-hmm.
Another significant focus of your work is pelvic floor therapy for women. What drew you to pelvic health, and what do you wish more women understood about the kinds of concerns physical therapy can help address?
Yeah, I am a mom of three. So after having my first child, I realized that your body doesn't quite return to the way it was before having children. And I sought out help from a pelvic floor therapist who really opened my eyes to a lot of things that pelvic floor therapy can help, especially with prevention of leakage symptoms or pain or different things that you feel like you can't recover from because maybe you don't know that there is an option. So really what I would love to share with women is that there are options for all those symptoms, and you can return to your baseline or as close to baseline as your body will allow you to.
That range of care from women's pelvic health to sideline coverage shows how varied physical therapy can be.
Mm-hmm.
Let's turn to your combined background in physical therapy and athletic training.
Okay.
How does being both a physical therapist and an athletic trainer affect the way you evaluate and care for an injured athlete?
Yeah, I think it's great because I'm able to take a dual approach to my patients. I understand the how. I've seen it live, I've seen it in action, and then I understand the how of it happened and now how I want to get you back to that field. And the combination kind of is like this fun active population, active rehabilitation approach that someone who maybe isn't in the world of active sports doesn't always see or feel or understand as much.
Let's put that dual perspective into a real sports scenario. When an injury occurs during a practice
Mm-hmm.
or game, what are you looking at first? And how do you determine whether that athlete should stop participating?
That's a big question. The first thing you're always concerned about is the player safe? So depending on if you're on a football field or a basketball court, you're always going to make sure that the player is safe and that there's no emergent medical issue that would require you to call 911. Once you have established that there's no significant emergency, then you typically will assess the player on the field for a quick assessment, and then you're going to bring them off the field and go into a further, deeper dive, and then figure out from there are they somebody who can return? Is it just something that was like a bruise or a tweak versus something that's more significant that would affect their play? So using some of my evaluated skills from both my athletic training and my physical therapy help me figure out whether that person should return or not return.
That initial decision is important, but it's only the beginning of the recovery process. Once that athlete begins physical therapy,
Mm-hmm.
how do you create a rehabilitation plan that prepares them for their specific sport, not just everyday movement?
Yeah, that's the fun part of what we do is being able to say, okay, I'm going to take this football lineman and I want to return him or her to being able to block and tackle. And so you have to be creative in your choices and make sure that you are meeting the goals of that patient, but also meeting the goals that you have set for them as a therapist, and then also meeting the goals of their sport. So it's a very comprehensive approach where you are involving the patient. Sometimes, you may need to talk to the coach and say, hey, how much does this player need to be able to push or pull in order to be successful in their position?
An athlete may start feeling better before they're prepared for everything that their sport requires. How do you progress someone from feeling better in the clinic to being physically and mentally ready for practices, games, or competition?
Yeah, we have some standard tests. So it's really great because you can do limb symmetry tests. So you can, let's say you're rehabbing an ACL, you can do tests on the uninvolved side and then on the involved or injured side. And you can show the patient numbers. You can say, okay, you're 90% of your involved side compared to your uninvolved side, and then we have goals. So if somebody is under a certain percentage, we don't really want to return them to sport. You can also bring in research, which has statistics and on recommendations as well on what is the safe time to return, because a player might say at 4 months, I feel great, I'm ready to go, but then you can show them from research and from their numbers that they're not really quite ready to go, even though they feel ready. So lots of patient education, and that usually helps with the mental component as well.
You've guided athletes through that process at many different levels. You've treated professional, collegiate, and recreational athletes. What changes depending on the athlete's level, and what principles remain the same?
Depending on their level, it doesn't change a ton. It might just be that with the higher level athletes, you are doing higher level stability exercises. It really, as long as you meet their specific goal and what they were capable of before, you want to be able to return them to what they're capable of after.
Regardless of their level, athletes and active people naturally want to return as quickly as possible. What is one of the most common mistakes you see athletes or active people make while recovering from an injury?
Yeah, sometimes it's going back too soon. We always have the fun kind of joke about runners. Runners are very addicted to running, and so it's really hard to get a runner to shut down when you need them to shut down to help with the rehabilitation and the healing process. So you really just have to do a lot of patient education. But going back too early is probably the number one mistake that we end up seeing.
Your experience caring for athletes and active people has also helped shape full-strength physical therapy itself. You're not only a practicing physical therapist, you're also the owner of full-strength physical therapy. How has your clinical experience shaped the kind of practice and team you've wanted to build?
Yeah, having collaboration is huge. I love having a lot of therapists on staff where we can ask questions and bounce ideas back and forth. We've got cases that are a little bit more complicated, we can share patients back and forth. But having that collaboration is huge. And then it makes for a fun environment where patients come in and everyone's friendly and saying hello, and it just kind of becomes almost like a place you want to go as a patient. And so having that positive, fun energy, fun environment, but also one that is dedicated to that patient and to the rehab and the individual program so that patient can get better is very important.
To close, let's bring this back to someone who may be dealing with an injury right now. Okay. What is the one thing you want every athlete or active person to remember after an injury?
Yeah, you will heal. Time is a big factor in healing. We are your guide. We will help you take the right steps, whether we have to progress something or regress something depending on where you are, but time is a big factor. And we are here to support you. We're here to guide you. We're here to get you to the end so that you can get back to doing what you want to do.